Hi, you're listening to It Happened to Me, a rare disease and medical challenges podcast. The mission of our podcast is to support you, our listeners, and to create community as you confront the toughest challenges in life. All of us will experience health hardships. The real question is how we adapt. That's the focus of It Happened to Me, which wants to help you overcome limitations and live a full and satisfying life. Drawing on their own health challenges, co-hosts Kathy Gildenhorn and Beth Glassman interview guests who share stories and research to help you succeed in the face of difficult health obstacles. It happened to me. I'm not alone, and neither are you.
In this episode, we're learning about blood transfusion therapies with a focus on the patient experience. We have two experts joining us from Terumo Blood and Cell Technologies to explore this topic. Our executive producer, Dineen, will be joining us as co-host. Kira.
Thanks for having me join you guys. So I wanted to introduce at least one of our guests here. Lori Harada is a registered nurse who also serves as senior manager, technical excellence team for Terumo Blood and Cell Technologies. This is a team of 12 specialists who provide education and support for both the Spectra Optia Apheresis System and the Trima Accel automated blood collection system. Lori is no stranger to this industry. She brings with her almost 40 years of nursing experience, 35 of those years in apheresis practice. With her vast knowledge of blood transfusion and related products in this field, Lori provides unique perspective, insight, and understanding to bear for customers and ultimately patients every day. Lori is a leader in the industry and has moderated several webinars for the American Society for Apheresis and the American Society of Pediatric Hematology and Oncology. During her career, Lori has held positions ranging from apheresis operations and clinical training to sales and marketing. But her true love is education. Seeing a new operator catch the passion of treating patients with apheresis is what brings her the most joy, along with instilling knowledge in her specialists so that they share the passion of improving a patient's life.
Carly Newton is also a registered nurse and the manager of therapy access team at Terumo Blood and Cell Technologies. She has over 15 years of experience helping healthcare professionals treat sickle cell disease patients with special blood disorders. Specializing in blood treatments, Carly uses her experience to educate healthcare professionals on the most effective prescribed red blood cell exchange. By focusing on the different types of transfusion therapies available to sickle cell disease patients, Carly has been able to put her registered nurse degree to good use. Carly has spent her days at the Terumo Lakewood campus, but it's her patients that get her up in the morning.
Carly and Lori, welcome to It Happened to Me. I'm not alone, and neither are you. We're so happy to have you here today. Lori, let's start with the basics. What are blood transfusions, and what are some reasons that someone would need a blood transfusion on a regular basis?
Well, Kathy and everyone, thank you for having Carly and I. We really appreciate the opportunity to talk to you today. So what is a blood transfusion? A blood transfusion is the infusion of a blood product. What is a blood product? A blood product is red blood cells, plasma, or platelets. Now, as we were discussing earlier, there's a lot that goes into a blood transfusion before you ever get that blood infused into your vein. And that's important because we all have different types of blood, and the blood has to be typed and cross-matched to you as the patient from the donor who donated their blood for you. And the blood bank in the hospital goes through an extensive process to type and cross-match each unit that is ordered for a patient who is to receive that blood. So remember, when you go in for a blood transfusion, yes, it takes a while. First, they have to type and cross-match that blood, but then they can't give it to you really fast either. It has to go in over a certain period of time, and that's 2 to 4 hours of a slow IV drip of that blood product into your vein. Now, red blood cells take the longest to infuse. Platelets and plasma, you don't have to go that slowly, but they still do take time. So when you go in for a blood transfusion, you need to allow for a good period of time to get your blood transfusion.
That's really interesting because when you donate blood, you can donate blood much faster than you can then receive blood. So that's just interesting. As someone that donates blood, I would have thought it was faster for someone to then receive my blood later.
No, you need to allow the body to accept those donor cells, and you don't want to give it too fast because you want to be able to recognize if the patient is having a reaction to those red blood cells, because you want to stop that transfusion if there are any signs of a reaction and stop it immediately. So that's why you go slowly with it.
Carly, what are some unique challenges or opportunities you've encountered in your career as a registered nurse in the field of blood transfusion and apheresis practice?
Thank you, Kathy. And again, thanks for having myself and Laurie on your show. We're very excited to be here and talk about a subject we're so passionate about. So I guess, I've been lucky enough to work with physicians and patient groups across the globe. So I started my journey with this, with Terumo in Australia, and then I worked in Singapore for 4 years before relocating to Denver. And I find that one of the biggest challenges with this role is when you speak with people, professionals, healthcare professionals, some of the misconceptions they have around prescribing our technology. And that's find that really challenging because these people are highly educated, but there are things you could be doing to try and reduce the amount of blood these patients are exposed to make the experience better for these patients. And it's really challenging sometimes to go and talk to these professionals and have them, try and get buy-in for them to think about prescribing these therapies a different way. I know Laurie's team comes along some of these misconceptions as well when they're training on how to optimize these procedures. But because these procedures are so unique, I find that's one of the biggest challenges is just some of the misconceptions around the therapy, and then really educating people to, change their SOPs and change their therapies.
How long has the therapy been around?
Red blood cell exchange, that's a really good question. I know plasma exchange has been around since the 70s, right, Laurie?
No, actually, plasma exchange has been around since the 60s. And red blood cell exchange, I was doing red blood cell exchange in the 80s. So probably sometime in the 70s, they developed red blood cell exchange. There's a whole history behind how this technology was developed. But it really came to modernization in the 60s and 70s.
But you're finding a hesitancy or a lack of knowledge on the part of doctors?
So I guess there's different types of transfusion therapy that you can prescribe a patient with sickle cell disease. So the reason why these sickle cell patients get prescribed a transfusion therapy is because of the nature of sickle cell disease itself. So sickle cell disease is a disease, it's a genetic disease, mostly from African American or Middle Eastern heritage. And with sickle cell disease, what actually happens is that these patients have a red blood cell typed hemoglobin S. So instead of the hemoglobin A cells that normal healthier people have, these hemoglobin S cells, when they become anemic, they become rigid. And when they become rigid, they can get stuck in vessels around the body. And so what that does is it causes some hypoxia in different parts of the body, depending where these sickle cells get stuck. And so what that can cause is pain crisis. It can cause organ damage. It can cause strokes or occlusions in your lungs, in your chest as well. So part of transfusion therapy is to really increase the amount of oxygen in these sickle cell patients' body. Okay. The other symptom of sickle cell disease is the fact these patients are in a chronic state of anemia, and that's because these hemoglobin S cells only live for about 15 to 20 days compared to a hemoglobin A cell, which lives for about 120 days. So the role of transfusion therapy is to actually increase oxygenation for these patients to keep them healthy. But the thing with these transfusion therapies is there's different types. So there is a simple transfusion, which what Laurie talked about earlier on, which is just simply cross-matching the red cells for these sickle cell patients and just have them sit there and have the blood drip in over 3 or 4 hours. They can do that once or twice a month. Our technology allows physicians to prescribe what we call red blood cell exchange. So what that means is, as the patient's connected to our machine, blood's continuously pumped around our system. It's separated in a centrifuge into red cells and plasma. The machine pumps or directs the red cells up to a waste bag, and then we infuse with healthy donor cells. So what that means is we're continuously exchanging the blood. And so there are some benefits with that. And one of the biggest benefits is the fact that when you do a red blood cell exchange, you don't increase the iron levels in patients' bodies. And that becomes really important because it can negate the need to have these patients on chelation therapy to try and reduce the iron in their body. If you have too much iron in your body, it can actually cause damage to organs. So that's just a little bit about why these patients need transfusion therapy and the differences between our therapy and simple transfusion.
Is the exchange, are you likely to get an infection? How do you prevent infection from occurring?
No.
As you're doing the exchange?
No, so there's no increased risk of infection. We can actually do these procedures via a peripheral access. So getting access to the patients, we can puncture the skin with the same needle that is used for transfusions, just a bit bigger, but we can still do it peripherally. We can still do it single needle. So there is no increased risk of getting an infection doing a red cell exchange if you do it peripherally. Now, if you use a port or catheter, well, then that does increase the risk. But if you're doing it peripherally, then no.
So I would imagine that this would maybe help other people with other conditions. Like I think about beta thalassemia or other blood, genetic conditions. I come from a genetic background, so that's going to be first to come to mind. But are there other conditions where this is a treatment, or is it really mostly sickle cell because you're looking at replacing those red blood cells as you described? They're in this like sickle shape. So think of like a crescent moon.
Yeah.
And that's why they're getting stuck. And whereas, compared, I don't have sickle cell, my red blood cells look like a nice healthy donut where we have, and it kind of flows much easier. And it's like a flexible donut is kind of how I think of things and make myself hungry during recordings. But is there any other conditions, you think about, or other ways that you're educating, doctors and healthcare providers to say, we can use red blood cell exchange as a treatment for this list?
Kira, I'm thinking blood cancers.
Yes. That is that
what about
also
a blood
related?
cancer? Would
Leukemia,
that be something?
lymphoma?
Yes, all the blood cancers. Would this be helpful?
So the American Society for Apheresis puts out guidelines every 3 years for how red blood cell exchange is used, how therapeutic plasma exchange is used, white cell depletion. So all the therapeutic apheresis procedures, they have a guideline that they put out every year. Our particular company has the indication to treat sickle cell disease, but there are many other diseases that can be treated. So if you think about red blood cells, they can be infected with a virus or a parasite. They can be defective, like in sickle cell disease, or you can have too many or too little, right? So there are many different diseases that can be treated with red cell exchange.
And I would love to get a little bit more of your perspective, just because you both have worked with so many healthcare providers. I imagine also an extension to that, so many patients. How is your experience helping healthcare providers? And all over the globe, as I'm learning, shaped your understanding of the unique needs and challenges faced by people that have sickle cell disease and this patient population?
Yeah, so the biggest thing is that, I mean, we're so lucky working with these hematologists that have just got such a passion for helping these patients. You know, they're committed to, you know, doing trials, to get them enrolled in trials to try and increase the lifespan of these patients. The average age of a sickle cell patient is only in the mid-60s in the US at the moment. So, you know, when you work with these physicians, they always want to know and get input, and they're always eager to learn about how they could be better prescribing treatments for patients. So your original question was around, what do we educate physicians on, correct?
Yeah, just what you've learned from educating physicians and what they say back in terms of what patients really need and are looking for. And as we've been talking, I'm even thinking for the people that I've known that have sickle cell, they go through these crises where they're in immense amount of pain from this. And I'm wondering if if you've seen that people that are on this therapy of doing the red blood cell exchange, do they see a change in symptoms of having less of that because they have less of the sickle red blood cells in them? Like, you know, I'm just kind of thinking it through in the moment.
Yeah, for sure. So there's a couple of things with that, is the fact that we are very passionate about educating patients to empower them to make decisions. And so while red blood cell exchange might not be right for every sickle cell patient, we want them to understand that there are differences. There are some benefits to RBCX, to simple transfusion. So, you know, what we do is we do a lot of work with patient education groups, and we educate through them sickle cell patients and what questions to ask their physician. The physician, we really educate them on how to prescribe this therapy, because like we talked about before, it isn't as common as the simple transfusion therapy. And so there are some niches and some nuances to prescribing it. And every prescription for this therapy should be done on an individual basis to make sure that we're using the least amount of blood and exposing the patients to that least amount of blood as possible. So to your question around, does it actually reduce these vaso-occlusive crises? That's what you talked about when these patients come in extreme pain. Well, yes, there is some evidence out there that it can reduce the incidence of vaso-occlusive crisis. And there's actually, you know, a retrospective study that we use when we talk to physicians with recurrent painful crisis that actually reduced the amount of emergency visits they had for having these vaso-occlusive crisis admissions. So while that's not a blanket statement that it's going to, you know, help every single patient, there is some good clinical evidence out there that demonstrates getting on a very good chronic red blood cell exchange regime can reduce vaso-occlusive crisis. It can prevent secondary strokes, and it can also reduce the chance of having what we call acute chest syndrome, and that's where those sickle cells get stuck in people's lungs.
Yeah, and
this was exactly what I wanted to ask you. If you could talk a little bit about the success stories. We hear about the horrible pain that sickle cell patients go through, and the fact that it has an impact on their organs is just horrific, on top of the pain that their bodies are going to betray them because of this horrible disease. So can you tell us some of the success stories that have occurred as a result of the blood exchange?
Well, the real value of this is they get their life back. Their activities of daily living become normal again. They don't have those pain crises that put them in the hospital and give them narcotics. A lot of these sickle patients get labeled as drug seekers, and they truly are in pain. And if the pain can be controlled by being in a automated red cell exchange program where their sickle cells are kept at a reasonable level so pain crises don't happen, then they can live normal lives. They can grow up and go to college and get married and have children. They can do all the normal things that the six of us on this call do on a regular basis. But in years past, before red cell exchange was so predominant or was available, they would get labeled, and a lot of these patients would die before the age of 25.
Oh my.
Because
Oh,
of
that's
because of stroke. So it's important that we get the message out that this really does help these sickle cell patients to lead a normal life.
the passion with which you speak. It prompts me to ask the question, what motivated you to get in this field?
It's a long story. We don't have as much time, but both Carly and I started out as intensive care nurses. And I happened to be an open heart intensive care nurse. And my brother developed a cancer of the heart. And he died very suddenly from it. But his oncologist reached out to me and said, "Hey, how would you like to be my apheresis nurse?" And I said, "What is that?" I had no idea. And that was back in the mid to late 80s. And so this was early on in the generation of devices that we have out there now. This was probably 3 generations ago that I learned on. And I've seen so much in the field of apheresis over the last 35 years that it's really kept me involved and passionate about treating these patients, because I've treated a lot of patients with different types of apheresis procedures, and they change in the middle of the procedure. They get better. They start talking to you. They start moving. It's amazing.
How gratifying. Yeah.
It is. It's very gratifying. So
in a way to deal with your grief, you gave back. What a beautiful story. Carly, what motivated you to get involved in this blood exchange?
Well, like Larry said, I was an intensive care nurse. I was actually working in an intensive care trauma unit. I was doing some retrievals and working in that field. But I've always had this passion for education. Every time a student nurse would come in the unit, I would always be the first one to put my hand up to have them come and spend the day with me. And I was looking at getting into more of a commercial role with education just for a couple of years. That's what we always say, right? And now we're like 15 years later. But, was really looking at trying to get into a commercial company. And the recruiter contacted me and said, "I think you'd be a great fit for this small company in Australia called Terumo Blood and Cell Technologies. They do apheresis." And I had the same response as Laurie, apheresis. I was like, in intensive care, we would do the occasional plasma exchange, but we would, use different technology to do that at the time. And so was just lucky enough to fall into this industry. And it's such a niche industry. I mean, when you look at, how many procedures we do a year on our machine in the US, it's about 200,000. So it's not huge volume of numbers, which means the nurses, the intensivists, the key opinion leaders are just so passionate about, educating people to make sure we can get the best access for these procedures. The nurses are just so committed to learning about the procedures and helping their patients. And then we get this roll-on effect that, Laurie's team is just so committed to making sure these nurses have everything they need. It's just such a wonderful community. And I think what keeps us all going is the fact that when we see results with patients, it motivates you to do better and better.
I would say that Terumo found 2 extraordinarily competent but highly compassionate people.
Absolutely.
Thank you.
Your patients are very lucky.
They are indeed. And Laurie and then Carly, I've got to follow up with both of you have expressed such passion in education. And I'm wondering, how do you balance the need for continuous education and continuous learning and staying updated with the latest advancements in apheresis practice?
That's a very good question, Kathy. It can be very challenging to stay up to date. We do a lot of reading on the research that's going on out there. We learn every day. We're out training new nurses because every time I train a new site, they teach me something new. And I think that continuous education process of being out with the customers, out with supporting patient procedures is a way for us to keep our knowledge base up. And when we hear something new, we ask, tell me more, tell me more.
Wow. And Carly, how do you balance?
I think it's just having that inquisitive mind and asking, tell me more. That sounds like a unique situation. How did you manage that? So I think the great thing about our job is the people we speak to just allow us to learn about new advancements or new optimization skills every day. But I think it's really important, no matter how busy you are, is to carve out time to actually attend conferences, to be able to read articles, and to keep yourself updated through that. And I think this is a life lesson for everybody in the fact that we are so busy, and it's so easy to deprioritize, reading that article or, going to that conference because I could be doing X, Y, and Z instead. And so we're really lucky at Terumo that, we've got a culture of lifelong learning, and that, we're really encouraged to carve out time to be able to grow and be able to keep up with best practices.
Well, you all have both been phenomenal today. I mean, we have more to talk about, but I feel lifelong learning in everything that's resonating with me today. You've taught me so much, and I've learned so much, and I can't thank you enough, because you've really broadened my horizons and enlarged my understanding, and thank you. But I got to ask Carly and then Lori, how do you ensure that healthcare professionals are aware of the potential benefits and risks associated with apheresis treatments for sickle cell disease patients?
That's a great question, Kathy. So we're really fortunate at Terumo that we've got a great clinical technical team that Laurie runs. And so we have invested into programs for healthcare professionals. Laurie's now got a course that she runs. Is it half a day or a day, Laurie? I can't remember now.
It's about 6 hours.
It's about 6 hours that her team will take these healthcare professionals off the floor, and they will take deep dives into, some of the challenges of treating these patients, how to optimize procedures, how to actually prescribe these procedures so we are using the least amount of blood to get, results for the patients. We also are very involved there's some great university hospitals out there that run 1 or 2 day conferences educating their staff. So we're very supportive, and we're always, involved in those as far as supporting these university hospitals that have taken that initiative. And then also really working with key opinion leaders to run webinars to, speak to patient groups as well. So we're really lucky in the fact that Terumo supports education and invests a lot of time, to be able to support these healthcare professionals. I don't know if you want to add anything else, Laurie?
I think the only other thing I'd add is we also support sickle cell patients. Yeah. We have a lot of education for sickle cell patients so that they understand their disease, understand what their options are. We have a whole website that's devoted to teaching and educating sickle cell patients. And Carly, you know the website URL better than I do.
Yeah, absolutely. So that website for patients, caregivers, anybody that wants to go and learn more about sickle cell disease is reach.terumo-bct.com.
Wonderful. And we'll be sure to post that URL in our show notes so that listeners can easily access that information.
Be great.
So, Lori, what advice would you give to healthcare professionals who are thinking about pursuing a career in blood exchanges to help sickle cell patients?
Well, first of all, I encourage young nurses to get into nursing because number one,
so important.
There's a big nursing shortage.
Yes.
And there's a lot of versatility in the nursing profession. Look at Carly and I. We both started out as ICU nurses, and now we're in industry and we're helping educate both users and patients. In our little niche of apheresis therapeutics, it's an exciting role because not a lot of people know about it. And when they want to learn something new, they're very eager. And that's very rewarding for us. So what I would suggest to a new nurse is get into nursing. It's a great profession. I highly recommend it. And if you have the opportunity, if you're in an area that does have apheresis, look at it. Look at what it offers. Look at the benefits and look at the rewards that you get from treating these patients.
Carly, do you have anything to add to that?
No, like Laurie said, I just want to reiterate the fact that, getting a couple of years on the floor as a nurse gives you skill sets that just are matched to no other profession. I mean, you learn really your EQ skills go beyond, what you could ever imagine. I mean, you're speaking to family and friends probably on the worst day of their life, right? You're helping manage them through that situation. You're learning to prioritize. I mean, when we talk about prioritization from a commercial perspective, those years on the floor, you just learn that those skill sets, and it can be transferred over to any other profession, really. And so I would say that nurses thinking about a career in the commercial sector, that yes, it's a great transition. We need nurses in the commercial profession to help get access of treatments to patients and help develop new products. But you just can't underestimate the value of spending some time on the floor as an acute nurse. And I just know people, when they ask me around, you're so good at prioritizing, you're so good at diffusing situations. I learned all that, just from being an intensive care nurse, and just forever grateful for that.
We've listened now to the plight of patients who have sickle cell, and it's just devastating. And I wondered, Laurie, if you might have any advice for people listening to this program, how they can help. One thing that comes to mind would certainly be donating blood.
You're absolutely right, Beth. Donating blood is probably the number one thing that you can help sickle cell patients, because they get exposed to so many different types of blood, not A, B, O, but the different other types that go along with cross-matching a unit of blood. They develop antibodies. And when you cross-match a sickle patient's blood to donor blood, it's a tedious process. And you have to have special blood, diverse blood, to be able to match to those sickle patients. We really encourage the African American population to come in and donate blood, because that's the blood that really matches the sickle cell patients better than the Caucasian blood. They all will eventually get matched, but if you could go in and donate once or twice a year, I mean, the minimum is once a year, but you could go donate every 2 months if you really wanted to. So if you are out and you live in an area where you have a blood center that you can go donate blood, please. The shortage of blood right now is, the pandemic has really caused, or the endemic, I guess it is now, has really caused a shortage of all blood products, whether they're red blood cells or platelets or plasma. We really need to build our supply back up.
And
so
it's
think
so
about
thank you to do. Yeah, like I use the American Red Cross app personally, and it's so easy that I can just put in my zip code being in America, and I can find the ones that are local to me. I have a place 10 minutes down the road from me that I know I just go into. I'm out of there very quickly, and then I go to work, and it's a beautiful, easy setup. I get some free snacks and swag. I can't recommend it enough. And then the feeling of knowing, wow, this is going, and you get all the stats too of like, how many gallons of blood have you donated? My brother has me beat, but sometimes I go in, my iron's too low, but once in a while, but I try to eat my leafy greens and everything, but it's a great way to give back in a very unique way compared to what other guests say of, oh, what can you do? Go to our website, donate. It's like, okay, donate your blood. It's a little different, but it's amazing. I can't recommend it enough.
Yeah. Lori, I did not realize there was a shortage. I really did. It's been for years, realize right, guys? That was a shortage. And thank you so much for telling us that. I had no idea.
Well, during the pandemic, people didn't get out and donate because no one went out.
Makes sense.
No one went anywhere. And we used to do, community blood drives where the local church would set up their basement, and the local blood center, whether it's Red Cross or Vitalant or whoever, there's so many across the country, that they would come in and they would collect blood in the basement of churches. Well, that disappeared. And then going into a blood center to donate at their facility, they limited how many people came in because of the pandemic.
Yes.
So we're trying to play catch up.
Yeah. And that's actually why I started donating is during the pandemic, like pretty early on, because I have friends that are in the genetic community, and they were going in to get their routine blood transfusions. And some of them said, I'm sorry, we don't have blood for you. And once I heard that, it was like, these are people that I know, which always makes things feel more magnified when it's someone
more personal.
They went and they could not get their treatment. And their treatment is, as we've been talking about, of having a blood transfusion of some kind, and said, try to come back tomorrow. We don't know. And they had never heard that before in their life. So it's like, if you do one thing, if you get one thing out of this episode, go donate blood.
Go donate blood. Carly, before we finish up, anything you would like to say to our listeners before we close?
Again, reiterating what Kira said, there is no better feeling than going into a blood bank and knowing that you can save up to 3 lives, just with that 45 minutes if you spend donating whole blood. So, my compassionate plea is that Laurie talked about how these sickle cell patients sometimes find it really hard to get matched to certain types of blood because they've developed these antibodies. And it's really important that you talk to all of your friends and family about donating blood, because the more diverse we can get that blood pool, the more chance we've got at being able to cross match. So when you look at African Americans, 1 in 3 African Americans could actually be a match for someone with sickle cell disease. So it's really important that we ensure that we speak to our family and friends and really try and encourage everyone we know to go and donate blood. And there's no better feeling.
Great.
Wonderful. Well, Carly and Lori, thank you both for being a guest on It Happened to Me. I'm Not Alone, and neither are you. You really, really have helped to educate all of us and all our listeners about blood transfusion therapies and the patient experience. Thank you so much. Thank you.
Thank you both so much.
You're welcome.
Thanks, you.
Guys.
Thank you for listening to this episode of It Happened to Me. We encourage you to learn more at ithappenedtomepod.com. Please use the contact form on our website to submit your guest suggestions, comments, questions, ideas, and feedback for the show. You can also email us directly at ithappenedtomepod@gmail.com. We would really appreciate it if you can leave us a 5-star rating and review on your podcast app like Apple or Spotify. This helps others in the rare disease and medical challenge community find us. It Happened to Me is created and hosted by Kathy Gillenhorn and Beth Glassman. I'm Kira Dineen from DNA Today, and I serve as our executive producer and marketing lead. Amanda Andrioli is our associate producer. Ashlyn Anokian is our graphic designer. And remember, it happened to me. I'm not alone, and neither are you.